Hi everyone, my name is Joshua Grimes. I'm a junior communications major with the minor in marketing, and today I'm interviewing the amazing Dr. Azonobi.
Very nice to meet you, Josh. As you said, I'm Dr. I'm Azonobi, and I'm the medical director of the Student Health Clinic here at GSU.
Great, nice to have you here, and we just wanted to ask a couple questions about the COVID-19 vaccine. Firstly, why is it important for Georgia State students to get vaccinated?
Well, one point is that while there have been decreases in the rates of COVID-19 infections across the country and in Georgia recently, there is some evidence that there's an uptick in the rates of infections, especially in particular in Georgia. So COVID is still real, it's still here with us, and we still need to be doing something about it. Another point is that during the pandemic, we did really well when it came to social events that involve social distancing and virtual events to replace or try to give us that campus social life that we enjoyed pre-pandemic. But getting vaccinated will allow us to have a much more normal campus life as compared to what we did during the pandemic. So for those of us who want to enjoy those events, getting vaccinated is an important part of that. And finally, it's also an opportunity for us to kind of take control of the situation. A lot of us were feeling some levels of helplessness during the pandemic. Being able to do something that can allow us to protect ourselves during this time. This is an active, tangible way of being able to protect yourself against COVID-19 by getting yourself vaccinated.
Absolutely. And following up, so many young people or students will feel as though they don't get sick as easily, so what do you say to those students?
That's the truth. That is the truth. Young people, as the majority of our campus involves, are young people, they don't tend to get as sick from COVID when they get infected. But that doesn't mean that they don't get sick from COVID, don't get severe illness when they get infected. Young people still do experience severe disease. They still experience long-term consequences from COVID-19. So of course, the best situation is to do the best you can not to get sick at all, whether you're young, whether you're old, whatever your situation is. So it's very important that they still keep that in mind. They can still get the disease. Another thing is, you may have heard of it, others may have heard of it, but there is this thing called variants of the COVID-19 virus. The virus is not just one thing. There are multiple different kind of subtypes of the virus as it mutates. And one really dangerous variant you may have heard of is called the Delta variant. It is highly infectious. And so that's kind of almost a new type of virus in a way, being plugged into the U.S. population, and that is definitely on the rise as well. So young people still can get sick. We have new variants that are coming and developing, and they will continue to develop while people still haven't been exposed to. People can still get sick from the COVID-19 virus. And finally, even if you don't do it for yourself, there's reasons to do it for other people. Even if you're young and healthy and don't have any problems, if you get the infection, young people are the ones who are more likely to transmit the disease to other people who are at higher risk, people like your family members, your friends, your roommates, your neighbors. All of those people could potentially be at risk. And if you want to protect them and protect your community, getting vaccinated is an important part of that. For myself, getting vaccinated was important for me to do for my mother. I live with my mother who's elderly, and at the time, he was an unborn child. So it was important for me to protect them. And so there may be some people that are important to you as well that you need to protect when you're getting vaccinated.
Absolutely. And lastly, are vaccinations safe?
Absolutely, positively safe. There's all of the evidence that we have so far points to the fact that these vaccines are not only effective against COVID-19 and multiple variants of COVID-19, but they're extremely safe. That there are no, as far as we know, long-term consequences from getting the COVID vaccine, which is similar to other vaccines that we have. That we don't have any long-term consequences for most vaccines that are out there and available. So yes, the COVID vaccines are extremely safe.
Gotcha. Well, thank you so much for taking the time out to answer these questions for us. We really appreciate it.
Thank you.